health insurance companies dictate way too much in healthcare today. Meaning, a lot of times we're waiting on health insurance companies to make decisions on patients' medical care versus the patient and the provider are the one making those decisions for medical care. And what I mean by that is, a lot of times insurance companies, you have to get a pre-approval or pre-certification, or they call it prior authorization from them before we can allow a patient to proceed, because if the insurance does not pre-approve it, it's going to fall to the patient's responsibility. And as everyone is fully aware, some of these tests and procedures that are in healthcare are thousands, tens of thousands, hundreds of thousands of dollars. And it's just unfortunate that the insurance company has that much power in our current system. Like for an example, let's say you see your doctor today and you want to go and have an MRI done. He orders an MRI for you, or she orders an MRI for you. You have to submit a request to your insurance because they require prior approval, and it could take a few days. Some insurance companies say they have 10 to 14 business days before they have to legally give a reply back to you. So that's 2-3 weeks that you're sitting and waiting for your insurance company to make that approval for you. And it just doesn't seem fair to me, because it hurts the patient. The patient is the one that has to wait for their insurance company to make that determination if they're actually going to pay for these services or not. And it just it gets frustrating. It gets frustrating working with these big insurance companies day in and day out. For me, I think a quick and easy solution is you proceed with the appointment, you submit the claim to the insurance. If it gets denied because it wasn't medically necessary, then that should fall to the provider's responsibility. It should fall on the hospital. It should fall on the doctor who ordered that test for you. They shouldn't be ordering stuff that you don't need to have done, which I get. That's why they want to do the pre-cert or the prior authorization procedure. Insurance companies don't want to be paying for a bunch of stuff that they don't necessarily need to be paying for because healthcare is so expensive. So I understand why we have that process. I just don't like how it falls on the patient. The patient is the one that gets screwed. To me, like I said, if you want to proceed with the surgery, if you want to proceed with the test, instead of making the patient sign a form stating that they're going to be financially responsible in case your insurance doesn't pay, I feel like that form should be signed, and it should be the provider, because it's the provider that's going to know whether or not this patient should have a test. I mean, when you're a patient, you're going based off of your doctor's recommendations, and then you sometimes will go get a second opinion to see if this is really the plan of care that you want to do. So for me, if you're getting your information from your provider, why is the patient getting stuck with a large bill if your insurance decides not to cover it because they deemed it as not medically necessary? So why is the patient get stuck with that? Because their doctor is telling them that it was medically necessary and that they needed to do this test. So that's I feel like it's an easy fix too. I feel like that we could easily fix that. Granted, some of the providers probably won't like that idea, and I work for providers, so I get that they wouldn't like that idea. But again, for me, I created this page to help patients out, and so this is patient-centered. And if we're really wanting what's best for the patients, I think that's something that we should be looking towards doing.